At the top of the hour, we told you about Governor Snyder being hospitalized for a blood clot in his leg. The governor developed the clot about a month after undergoing surgery for a torn Achilles tendon. Well, tonight, Dr. Matthew Tiede from Mercy Health St. Mary's joins us to talk a little bit more about the risks of developing blood clots. Thank you so much for joining us. First of all, why do we have to worry about these? They can be dangerous.
Absolutely. The blood clot itself in the leg isn't necessarily a problem. It's if it travels, and when it travels to the lungs, and that's when it becomes life-threatening.
Yeah, something to watch out for sure. Well, now the governor recently had surgery for his Achilles tendon.
Yes.
So does your risk of developing a blood clot after a surgery increase?
Yes, it does. That's unfortunately not an uncommon story that we hear. One of the biggest risks is any reason for immobilization, injury, or previous surgery. And the other story that we hear a lot of the time is long car rides, long plane rides, where
Yes.
patients are sitting still for a long time.
Why is that, do you think?
It's the stasis of the blood in the veins. They don't have the pressure that the arteries have, so the muscles in the legs are what they contract and allow the venous return to come back into the heart.
So after a surgery, it's just a little slow.
And it's sitting still.
Yeah, okay. Our political reporter, Rick Albin, earlier in the newscast, he said he saw the governor earlier this week. He said that he looked pretty tired. Are there warning signs if you, say, had a surgery recently that you might be a little concerned about not knowing if you have a blood clot? How can you tell?
Most common symptoms are either swelling in the leg or pain that begins to travel up the leg. The clots usually start below the knee and work their way up.
Okay, so any other feelings like fatigue or anything that would be unusual other than the swelling?
Not necessarily as related to the blood clots. One of the risk factors can be dehydration, so anybody who is particularly after surgery, if they're not moving around a lot, they're not eating and drinking like normal, that can raise their risk factors.
And very quickly, does age have anything to do with the increase of blood clots for people?
Yes, older patients are more susceptible. Anybody with smoking history, chronic diseases, particularly cancers, those all raise your risk as well.
Okay, something to watch out for. Doctor, thank you for coming in. Dr. Matthew Tiede from Mercy Health St. Mary's. We appreciate your time today.
Welcome.